Welcome to the Person-Centered and Behavioral Support Training, presented by Vagthal's Residential Care Center, Inc. Today, we will begin by focusing on the fundamentals of person-centered care. Person-centered care focuses on the individual's needs, preferences, and goals, promoting dignity, respect, and autonomy. This approach empowers residents to make choices and participate in their care, enhancing their quality of life and well-being. Intellectual disability involves limitations in intellectual functioning and adaptive behavior. Residents may require assistance with daily living activities, and individualized care plans are essential. Be aware of common challenges like difficulty with problem solving and the need for structured routines. Next, we will review an important part of person-centered care: resident rights. The HCBS Final Rule ensures individuals receiving home and community-based services have the same rights, choices, and freedoms as anyone living in the community. Key principles include person-centered planning, informed choice, privacy, dignity, respect, and freedom from coercion. The HCBS Final Rule outlines 10 core requirements, including access to the community, choice of setting, the right to privacy, dignity, respect, and the right to be independent. These are all vital to a resident's well-being. A major component of respectful communication and resident rights is using people-first language. Effective communication promotes dignity and positive relationships. Use people-first language, putting the person before the disability. Speak to the individual, not about them. Use a respectful tone and avoid assumptions or judgmental language. Staff should respect resident preferences and encourage self-expression. When referring to a person, use appropriate people-first language. For example, instead of disabled person, say person with a disability. For mental health, use, quote, person with a mental health condition, not mentally ill person. For autism, use person with autism, unless the individual prefers identity-first language. Replace terms like wheelchair-bound with person who uses a wheelchair. For medical conditions, use person with diabetes, not diabetic. Instead of behavior problem, use person with behavioral support needs. For cognitive or aging-related terms, use person with dementia, not dementia patient. Always focus on the person, not the condition. For dependency and care, use person who requires full support instead of total care. When discussing substance use, quote, person with a substance use disorder, or person in recovery, rather than addict or alcoholic. Respectful communication means avoiding, quote, baby talk. Residents are adults first. Using childish language reduces dignity, can increase frustration, and violates resident rights. Baby talk includes using childish tones or words, calling residents sweetie or honey, speaking too slowly or exaggerating words, or talking about residents instead of to them. Staff should always use the resident's name and speak in a normal, respectful adult tone. Use people-first language and speak directly to the resident, adjusting communication without talking down to them. For example, instead of, okay, sweetie, let's get you all cleaned up, ask, Mr. Lopez, are you ready for your shower now or in 10 minutes? Adults deserve adult communication that supports dignity and trust. HCBS requires residents to be treated with dignity, respect, and included in their own home. Speaking a language residents do not understand can be perceived as excluding, disrespectful, intimidating, or like staff are talking about them. DSP staff must communicate in a language the resident understands when in shared living areas, providing care, discussing activities, or speaking within earshot of residents. If residents only understand English, English must be used. It is not allowed to speak another language around residents for convenience, hold side conversations residents cannot understand, or discuss resident care or behavior in another language in common areas. Another language may only be used in private areas away from residents, during emergencies when calling for help, or when speaking directly to a resident who understands that language. The rule of thumb is, if residents can hear you, they should be able to understand you. Using a language residents do not understand may violate HCBS rights, increase anxiety or behavioral issues, damage trust, and be perceived as disrespectful or bullying. All staff must be mindful of who is present, use inclusive communication, and model professional behavior. Redirect coworkers respectfully if needed, and report concerns to supervisors. Language must always promote inclusion, dignity, and respect. Let's review some training scenarios. In scenario 1, a new staff member says, he's a disabled resident and needs help with everything. The wheelchair guy is waiting to be transferred, while a resident, Mr. J, is nearby. This language is incorrect because it labels the person by their condition, removes dignity, and violates professionalism and resident rights. This type of language can easily be overheard by residents. The correct people-first language would be, Mr. J is a resident who uses a wheelchair and needs assistance with transfers, or Mr. J receives support with mobility and morning care. This puts the person before the condition and maintains dignity. In scenario 2, two DSPs are speaking Tagalog and laughing in the living room while residents who only understand English are present. Is this allowed? And what is the HCBS compliant response? This is not HCBS compliant. DSPs must speak in a language residents can understand in shared spaces. The correct response is to switch to English immediately and move personal conversations to a private area. Scenario 3. A DSP says to a 40-year-old resident, "Okay, sweetie, let's get our jammies on and go potty." Is this acceptable? And why or why not? This is not acceptable as baby talk is demeaning and infantilizing. The correct approach is to use adult, respectful language, such as, "It's time to get ready for bed." Adults must be treated as adults. Scenario 4. Staff discuss a resident's behavior at dinner, saying, quote, "She's being difficult today. She didn't want to shower," while the resident is sitting at the table. What is the correct HCBS response? This is not appropriate. Do not discuss resident behavior in front of them. The correct approach is to speak privately with supervisors and use respectful, objective language. Remember to talk with residents, not about them. Scenario 5. A coworker uses baby talk, saying, "Okay, sweetie, let's get our jammies on, okay? Time to be a good girl and take our meds." What should you do? You should redirect respectfully, saying, "Let's use adult language. She prefers to be spoken to respectfully." All staff are responsible for maintaining HCBS compliance, and you should report repeated issues to a supervisor.